Hi everybody, this is Megan, or I'm Megan from Holistic Care Medicine. I'm here today with you to share about stress and anxiety. I originally did this presentation for some college students to help them to identify and deal with, the stress and anxiety they feel before taking their major tests and exams. But in the past couple weeks, I've been called to share this presentation with you based on some of the things I myself am experiencing. The presidential election is coming up, and whoever wins, either way, there's going to be, some feelings, and there's already a lot of tension and animosity, and people really worried about what's going to happen. And not only that, we're dealing with COVID, and in dealing with, the fear of getting sick and our loved ones getting sick, and, the potential of how long is this going to last, and all the things that came with it, that just upheavaled our lives. And within that, our children are doing online school, or they're doing hybrid, which is some online, some at home, and it's just throwing us all off on top of a work schedule. So I've been called to really share with you some things that you can do in order to identify and maybe help ease what you're feeling and what you're going through. Like all my videos, I have a disclaimer. The information I provide is for educational and informational use only. I am not giving medical advice over the internet or through email. So if you feel like what I'm sharing with you is something that you would like to incorporate, or you would like to do, and you feel that you should seek the help of your medical provider, I highly recommend you to do so. All of the things that I'm advising you to do are things that are natural, and I feel like there are lifestyle changes that can help you, and it wouldn't hurt you. But if you feel that you need guidance, then I would definitely recommend you to seek medical care. Okay? So when I was doing this presentation, none of the students really knew me. So I shared about, my background, and to make it look, I shared my background so that they were able to see that, I do have an idea, and I do have knowledge of what I'm speaking about. And so I am a licensed acupuncturist, and I am a certified Reiki master, and I'm also certified in Chinese herbal medicine. And so when we talk about stress, in TCM, in the medicine I practice, there's no real definition of what stress is, because for me, it can mean that, I get tired. I don't want to deal with stuff. I would rather sleep. For my husband, he's constantly moving, and he has a hard time sleeping, and so he's on the go, and he's trying to figure out things. So, he's constantly more agitated than he is restful. So we all deal with it differently. And when we feel anxiety, a lot of times we feel it's in our chest, or the typical definition that we have for anxiety is like somebody hyperventilating in having a panic attack and hyperventilating in the paper bag. But for some people, anxiety could mean that their stomach is in knots, or they feel the urge to urinate or defecate, if they're feeling uncomfortable and worried about something. Everybody has a different way of responding. So the signs and symptoms that we get when we're stressed lets us know that we are not in our optimal state of health. We're not feeling great. In TCM, in the medicine I practice, as the slide will move shortly, because there's no definition, we have to ask questions of people as to what's going on. Are they sleeping well? Are they falling asleep easy? Do they toss and turn through the night? Do they wake up refreshed? And if they come in saying they have anxiety, Where is the anxiety? Is it in the heart, in the chest area? Do you have a hard time breathing? Do you have a hard time eating? And headaches, tension headaches, when we're worried and stressed and you feel like you're holding the world on your shoulder. A lot of people tend to have that occipital headache, or they have that binding and that gripping feeling on the sides of their head, the temporal headaches. Some people can get it on the top of the head. It depends on the person and what's manifesting on the inside or brewing on the inside and showing up. Fatigue. Like I said, when I'm stressed, I don't want to do anything. I just want to rest. I feel tired. And restlessness, meaning like, you feel agitation and you gotta keep moving to feel like something you're being productive. Some people have poor or excessive appetite. So, sometimes when people are worried or stressed, they like to eat. And even though they're eating, they're not moving, so they're gaining weight. Or they don't want to eat. They have no desire to eat. And sometimes when we're not in our optimal health, we don't want to do the things we like. And one of the other things that we notice is a decrease in libido. You have no sexual drive. You have no desire to want to engage in any activity. So when the body is not at ease, it's not feeling great, you're not happy, you're not feeling good on top of the world, then there's a discomfort, there's a dis-ease to it. And we know that if you don't take care of yourself in that dis-ease, it can cause disease later on in life. So anxiety, like I said, is not a term that is defined in TCM, but there are signs and symptoms that we know and we are aware that manifest that can tell us that something's going on. A lot has changed in the last 9 months because of COVID. And I fear that because there's so much uncertainty about what's going to happen after the election and how this COVID's going to be handled, how the economic situation is going to take a turn, even with, going back to work and the kids going back to school, there's so much uncertainty that is causing fear and panic and mental restlessness and agitation in a lot of people. So in the medical community, we are actually seeing this already presenting even more so than before. And my fear is that as we move forward, I'm not sure how many years down the road, there's going to be a lot of people with PTSD symptoms, like it's a post-traumatic stress, and there's going to be issues. And even our children who don't really have the words, but they know something's off, will be suffering because of this. So as parents, as caregivers, as loved ones, it's good to be able to identify what you see and what you're knowing, to be able to help those that we love to be able to help themselves. Okay? So the next slide is basically how we look at the individual. There's one of two slides on how we look at the individual. So one theory is that there's 5 elements, and when they're balanced and they're working in harmony, we move in and out of things appropriately. Meaning, like if we're angry, it's an appropriate time to be angry. And if we're happy and excited, it's an appropriate time. If we're laughing and being joyous, it's at an appropriate time. 2 examples I can give that are when somebody's out of balance is that, say somebody says, hey, good morning, how are you doing today? You're like, I'm fine, I'm good, why are you asking? You sound angry, and it's not an appropriate time to be angry. So that's your liver saying something's going on, okay? And in terms for the joy, the fire, one of the examples that is that when somebody doesn't have enough, we call it Shen or spirit or calmness in their heart, that, when they're not settled and they're saying something that's not appropriate, they laugh, they giggle. So it's kind of, an example would be if somebody said, oh, my so-and-so passed away, and you're like, oh, I'm so sorry to hear that. Like, you're not trying to laugh, but like your heart can be settled, so it's like a giggle and a laugh. And that's how that might present itself. And so we know that that's not balanced. There could be other examples, but I'm just going to give those 2 for time. But that's how we know based on the elements, on whether they're people are moving appropriately or out of inappropriately in situations to figure out what's going on. The other thing in theory, and the other theory is that, you know, you have 12 organs, and when you're in optimal health, they're all chugging along, doing their own job and doing what they're supposed to do. But when one is out of balance, the other ones have to shift in order to figure out, you know, how do we make this person function? And so times of when you're angry and frustrated and irritated, you know, we call it liver chi stagnation, where you just feel tense. There's nothing moving and everything feels stuck. And so when that's stuck, that energy's stuck, it has to go someplace. It has to like move someplace. And what it does energetically is move up to your digestion. And when it moves to your digestion, you either have diarrhea or you have constipation. It depends on the person. But the point is that when that liver is stuck and not doing its job, it affects the digestion. And when the digestion gets affected, then it affects your urination and your bowels, you know, and that can affect how you feel. So that affects your heart. So all of it, you know, when one is off, they all have to shift. And when they shift, then you're not feeling optimal. So balance to your organs is the key. And that's how we can help. So I just wanted to make sure that you understand that in our medicine, all organs have a function. They have a pathology. They are associated with an emotion, a taste, a smell, the seasons, and other energetics. But the point in treatment is to bring about balance and harmony to the whole body, mind, and spirit. And one of the things I have here is, how will this help you? If you were to go get acupuncture, how would it help you with your anxiety and your stress? And so it would help because if you're not feeling like you're flowing appropriately in and out of life or in and out of situation, if you're not feeling refreshed when you wake up, if when you eat you don't feel energy, or if you have if you're not going to the bathroom regularly, or if you're going too often, that's an imbalance. You know, even something as simple as urination, you know, if you feel like your stream is weak, that could mean that you have some chi deficiency. If it's too strong and, you know, you didn't drink a lot of water, then there's some excess going on. So by asking those questions in regards to how your body's functioning, we know how the organs are doing. So based on your signs and symptoms is how we would be able to figure out what's going on. So the next one is a typical visit I wanted to share is that you come in, you know, we find out what the chief concern is. A lot of people for this presentation would be anxiety. We check tongue and pulse. And the tongue is a picture of what's going on for a long time in your organs, and the pulse is a quick snapshot. Kind of gives us a diagnosis, and the tongue gives us a root and branch diagnosis. So it tells us what's been going on for a long time, and that's what's happening now, and the pulse confirms what's happening now. We would determine a diagnosis based on the organs or based on the 5 elements. However, the practitioner, we would create a treatment plan, and then before the treatment plan has come to a close, we would reassess to see, you know, how much progress has been made and where we want to go with treatment. So I'm going to share the next few slides is about 3 students, and these are just examples of patients for the purpose of the presentation. And that's in regards to let you know, what a typical patient might come in, or when a patient comes in, what they might be dealing with, and, you know, how we can help them. And my computer froze, I think. So I'm going to pause here. Okay, so here we go. Our patients, or our students, Mary, John, and Sue. So I'm just going to go through what they would come in if they were to come in with some issues, and then we'll go from there. So our first patient is Mary. Mary comes in with a chief concern of anxiety. Her symptoms are that she has wheezing and a sensation of pressure in the chest. You know, she has some depression or sadness because she's not able to go and socialize with her friends. And there's some hopelessness because she's not sure when is school going to open back up. All right? And she may have a hard time, you know, falling asleep at night. So she would be a patient that came in with those signs and symptoms. She is a 12-year-old girl going to middle school. Okay, as you can see, I'm just moving on for time. We have John, and John is a 23-year-old male. He's working 2 jobs. He goes to school full-time online. He's moved back home to save some money, and he's not happy with how he looks. So there's some emotional stuff going on there. The chief concern is anxiety based on the fact that, he's just tired and he's just constantly wants to sleep. And, he does probably have some issues with either digestion or some heart palpitations. So, those are his primary concerns. And then we have Sue. She's our mom. She's 38 years old. She has 2 kids. She's married, and she has MS. And she also has, on top of that, the worries and the problems of parents, moving in, needing to move in. And if all 3 of these patients are living now during COVID, and this is what we would typically see, they all come in with anxiety, but there's all their underlying issues going on. But look at Sue. Sue has been diagnosed with MS, and so she has an autoimmune issue. And so even though she comes in with that, our focus is, the anxiety. Based on the fact that we are treating the organs to be able to help the body to reach optimal health, can you see how and why acupuncture would be able to help almost all individuals to feeling better, or at least shifting them on the road to feeling better? So I just want you to be aware that, in Western medicine and in Eastern medicine, we treat the patient differently. Both goals, we both want to help our patients. We both want to see them healthy and, living their lives. The difference in regards to treatment is important. And I'm not saying there's anything wrong in it. I'm saying that's just how it is. In Western medicine, all those Mary, John, and Sue would go in and tell their primary, I'm having trouble sleeping, I can't focus, I'm tired all the time, I have all this worry, and the doctor would prescribe the medication. And hopefully it would be depending on how much they weigh and, their size and what the patient would desire. If they don't want something strong, that the practitioner would work with the patient for that. But it would be a supplement in that, a prescription in that case. In TCM and in Eastern medicine, we look at each individual. So, for example, we would look at Mary, and we would say Mary may have heart qi deficiency and treat her organs of the heart and the liver and the spleen to help bring about balance. We would look at John, and he had the chronic fatigue, and he was just worried, and he didn't feel good about himself. And so he would be more of a deficiency, and we would help to tonify him, to give him more energy, and help the organs to be able to work more optimally in that case. And Sue's a little bit more complex because she has the underlying issue of the MS. But we're treating her anxiety issues. And if she's having digestion or digestive issues and bowel issues, then we would treat her intestines, the organs of those, to be able to function optimally, which by reducing those symptoms of anxiety will help calm, the issues that she might be having or flare-ups she might have with the MS. So I just want you to see how different we treat based on Western and Eastern medicine. And I want you to understand the definition of holistic treatment and holistic health. So WebMD defines holistic medicine as a form of healing that considers the whole person, mind, body, spirit, and emotions in the quest for optimal health and wellness. According to the holistic medicine philosophy, one can achieve optimal health, the primary goal of holistic medicine practice, by gaining proper balance in life. And I don't know if you hear the ambulance and maybe the police car that just went by, but right now there's a lot of unrest in Philadelphia, and it's not too far from here. And so, anytime I hear the sirens now, which come regularly, it's not a great feeling. But I send prayers and pray for everybody's safety. and hope that we find some peace soon. Because there's not much else we can do, and go and vote. So what can you do now if you are feeling any of those issues, meaning having problems falling asleep, digestive issues, heart palpitations, bowel issues, anything? What you can do is start by listening to your body. Your body is the first key to your health. And by honing in and listening to, you're able to gain the skills and understand what your body needs to feel better. So one example I give is the expired milk bottle. Okay, so you go in the fridge, check the milk. There's two ways it can go. You cannot look and open it and pour it in your bowl of cereal or in your dish and then see those little, whatever they're called, the white little specks that has turned, the milk has turned. Or you can open the milk and smell it and, have that, no, it's not good, and have your stomach lurch into a knot saying, don't send it down here. Those are the signs. So when your nose is telling you this is not good, then your mind has to be like, okay, I don't need to drink it or eat it. Your stomach is also telling you don't eat it or drink it. So start listening to those subtle signs. Sometimes, when you go pick something, you're at the restaurant, for example, and you're looking at the menu, and you look at something and your body's like, it's not for me today. And there's some things that make your mouth water and you want to eat, have it. Those subtle signs, the more you get attuned to it, the better you're going to be able to know what's good for your body and what's not. So it's really important to start listening. When you're tired, rest. When you're sore and achy, do something to help alleviate. Either move or rest. You know your body the best. Another thing you can do is watch what you eat. Nutrition is so important. We do not have the same amount of nutrition in our fruits and vegetables and food that we used to have. It just isn't going the same. It's not packaged the same. It's not shipped the same. We don't eat the same. So we already know that sugar, dairy, and alcohol are really bad for you. Above all, we know that sugar is like the worst thing you can do to your body. So what I tell my patients is to substitute or replace. I know it's hard to cut it out. So you can do honey, or you can do honey, or you can do no sugar, and just have your palate and your mouth, get used to not having it. Dairy, you can substitute with almond milk, coconut milk, rice milk. You can do frozen yogurt instead of ice cream. You can make your own kefir, your own homemade yogurt with live bacteria. That can be helpful to your digestion. Alcohol, it depends on the person. Some people drink it a lot, and some people don't at all, and some people socially. So I know too much of it can trigger cells in the body to do what it's not supposed to do. And food sensitivities. So even though you may not have a food allergy, if your body is responding by giving gas when you eat certain things, or you feel uncomfortable eating certain things, it's your body telling you have a sensitivity. So either you need to improve your gut digestion health, or you need to test to see if you are sensitive by eliminating that from your diet, from your foods. And if you don't have any issues, and you know that you have a sensitivity. And then you can determine whether or not you want to incorporate it into your life or not. So it's really important to eat the color of the rainbow, because that's about balance. It's about sharing a variety and having your body to be able to get nutrition from all different sorts of things. So that's really, really important. And I cannot stress how important it is to cut sugar out. Sugar is such, in my opinion, a carcinogen nowadays. So it's best to not have it as much as you can not have it. The other thing you can do is get enough sleep. When you're tired, you need to rest. And if you're not sleeping well and you're not getting up refreshed, if you have a hard time falling asleep, or settling down, that's telling you something. Your body's telling you it's not at ease. You need to sleep. You need to rest. You need to quiet your mind. All those things on the left-hand side helps you to feel better, be better when you have enough sleep. Now, what I recommend is having a sleep schedule, meaning that you have an idea of what time you have to get up. You play around as to how many hours your body needs of sleep. Now, children need 8 to 12 hours depending on the child. They're still growing. And, I know for my household, when the kids get enough sleep, they're in a better mood the rest of the day. But if you can work and figure out a schedule that works best for you, I know for me, I have to get up a certain time, like about 8 hours of sleep. If I can get 6 to 7, so I play around the time I have to get up and tell me to go to bed. And I get to bed a half an hour before I want to fall asleep. So if I tend to like to sleep by 10:30, 11, I try to be in bed by 10 or 10:30. It gives me enough time to at least, read a book or meditate. And a lot of times if I'm meditating or reading a book, I fall asleep before the time I'm supposed to. So it's about creating that habit and that schedule and getting into a rhythm. Life is all about a rhythm. Just like I said, moving in and out of situations appropriately is still a rhythm. I highly recommend no electronics near your bed, and I say 3 feet. You can have your phone as an alarm. You can put a sleeper on your TV, but if you get notifications, turn them off, because you're still on edge when you're listening or waiting for a ching or ping, whatever it is, a chime that comes through. And the dark room is the best. I know that, one of my nephews was diagnosed with leukemia and years ago, and we were researching as to what could have caused it. And one study showed that children with night lights on tend to be diagnosed more with leukemia than those that slept without a nightlight. And the only thing I can think of is the fact that logically the body heals when it's sleeping, and the cells are able to really rest and do what they need to do in the dark. So I think it's really good to be able to sleep in the dark. And if you can't even sleep in the dark room, at least if the child is scared, put a light outside of the room, but it's not in the bedroom with the child. Because then the body isn't sensing that there's light and that they need to be awake. The next thing I highly recommend is meditation or yoga in dealing with stress and anxiety, because one of the things that's most important, and once we get grounded into it, is our breath, and understanding that we are our breath. And that's nothing more important than being able to breathe, that it actually gives you a perspective about, what you're dealing with. If you can't catch your breath, and if you can't take a deep breath, then your cells are not getting the optimal oxygen that they need to be able to help you be grounded. And not being able to be grounded will let your mind go all over the place, and it's not helping the rest of your body. So meditation or yoga is a practice. And I say it's a practice because it is your practice. It is not a competition. It's not like, oh, I can sit here for 30 minutes or an hour. No, I can't. I struggle with 15 minutes. I struggle with 5 minutes. I struggle with 10 minutes. It depends on the day. It depends on what I'm going on, what's going on in my life. The point is to take the minute, to take the 2 minutes, take the 30 seconds, and learn to ground yourself and breathe through, to be able to rebalance, recenter, to be able to move forward in the possible way you can. And the more you do that, the better you get at it, the easier things that come into your life. It's not going to create the same stress. It's not giving you the same physical reaction. It's about control. So the apps I highly recommend are Insight Timer is my number one favorite. I haven't tried Breathe or Calm, but I heard they're good. I think I tried 10% Happier, and that was good. I really like Insight Timer because they do have beginner meditations that are less than a minute long. So for the people that say, oh, I can't sit still, I can't focus that long, it's like, listen, you can sit on the toilet for more than 2 minutes, and you can sit in your car for more than 2 minutes. So you can put it on and just listen to it. Even if you don't sit there and do it, just listen to it. The more you get into the rhythm of having that vocabulary and that calm voice and that time to yourself, the more and the better you'll get at being able to breathe and to be grounded and help yourself. It is your practice for a reason. Not mine. It's not your loved ones. It's not your children's. It's yours. And I'll tell you no from experience, the more a parent does it at home and creates a space to do it, the more the children are going to see that it helps. Because the more the parent is able to control their anger and, be more compassionate and soft, the better those children are going to be in response to you. So if you want to create your basic practice, you need to find a quiet space. Like I said, the bathroom is a great place. Your car or a corner, whatever, just find some place that's quiet. And if it's not quiet, just create a space. Be in a comfortable position, have a comfortable seat, wear comfortable clothes, and you just start with 2 or 5 minutes. So by watching what you eat, listening to your body, getting enough rest, and creating a practice for yourself, time for yourself, you will have overall success. You will have more control of your life. You will have more control of your health, and you will have more control about the decision you make and how you react to things, which will help to reduce the stress and help to reduce the anxiety that you feel. Okay, I do have a slide for my where it was questioned or needed, and this is my information. So if you want to give me a call and leave a message, or if you want to, I would prefer you shoot me an email. My first preference would be you to comment on the video and leave a question, or let me know what you think. If there's anything I can do to help make the video better, or if there's information you want that I can research or find, or if I have, I can definitely provide. But again, on the last note, this is for educational and informational purposes. And so if you are looking to incorporate it into your life and you feel you need to be guided by a medical provider, please do that. And definitely reach out to your medical provider for your own medications, and you're looking to incorporate other things into your lifestyle. The smartest thing to do is to be guided. Okay, and I want to say thank you. I know that the times that we're living in right now, was I think a century ago before people lived through it, but they did not have the technology that we have. So maybe that on the brighter note, we have the chance to still be able to be social and interactive with other people and see smiles and eyes. And even though people cannot see your smile behind your mask, they can sure read your eyes. So make sure you smile with your eyes. That will be my new tagline. At least until we're done wearing our masks. Anyway, thank you for your time, and I wish you all the best in health. All right, take care. Bye-bye.